Hi, I'm Daniela. I am Dr. Petropolis's patient care coordinator at Potomac Medical Aesthetics, and we are continuing our conversation on PRP and all of the incredible benefits of this solution, I guess we would call it. It's from your own body, it's from your blood. We draw your blood, we spin it in a centrifuge, we get the platelet rich plasma, and as we mentioned earlier in this month, it's something that can be used to address acne scarring. It's something that can be used to address hair loss. It can also be used for anti aging. And now we're going to introduce to you the P shot and the O shot, which are two treatments that can help with mild erectile dysfunction and vaginal rejuvenation. So, Dr. Petropolis, can you talk about those two treatments and how PRP helps with those conditions?
Sure. It's really cool. I think that the fact that somebody figured out that PRP can be useful, and we look to the pioneers of these therapies who injected themselves as well as close family members because there was a need. And this is the type of arena of medicine where you really need to pay attention to your patients because it's such a critical part of everyone's existence, but taboo for many people to discuss their sexuality. But it's very critical. And there are so many people, in my experience, that I've treated where you don't realize how much any sort of sexual dysfunction can have a very negative effect on a relationship, marriages, partnerships. When somebody has dysfunction, it brings a lot of difficulty to a union. So treating these issues can really strengthen relationships. And it's a really, really important part of our day-to-day existence. So PRP injected, whether it's a P shot into the man's penis to try to generate more blood flow, as well as nerve conduction and sensation, or whether it's vaginal injections, they're doing very similar things. The growth factors in PRP are trying to increase blood flow and increase new healthy tissue. I'll talk about the P shot. So the P shot is a great therapy. It's not a cure-all, but it can be depending on the range of erectile dysfunction. So if a male has some mild erectile dysfunction, this can get them back to normal performance. If someone's got moderate erectile dysfunction, we may need to couple it with some Viagra or Cialis and maybe shockwave therapy, or some people know as Gainswave, but the technical term is extracorporeal shockwave therapy. And if someone's got severe erectile dysfunction, well, it might help, but it may not be. Some patients are so far ahead in their disease that it may not be able to help them at all. So screening patients for the appropriate ability to do those procedures is very important. And then also screening for underlying endocrinologic issues such as low testosterone, low thyroid, also very important. So injecting blood in the form of PRP, platelet-rich plasma, into the male enhances blood flow, enhances nerve and tissue growth to try to reverse some of the underlying damage. I would tell you that 99% of erectile dysfunction, when it's not associated with prostate surgery or some sort of trauma to the area, is typically a combination of obesity, hypercholesterol, and hypertension. So if I have patients that have those things, many times their medications are the biggest culprit, or the underlying high cholesterol is causing blockage in some of the arteries, not allowing blood to go in. So PRP will help to try to reverse some of the dysfunctional blood flow. In females, which is what we do, the O shot, where we're injecting into the vaginal area, we're trying to regenerate through the use of PRP healthier tissue so that it allows better blood flow, more glandular secretion, so lubrication is increased, more nerve conduction, so sensitivity and orgasm is improved. Same as in men too. So that is how it works. And it's really neat, but it may not work for everybody.
So I know that the P shot is specifically for mild to moderate erectile dysfunction. The O shot, is that specifically for increasing the tissue and lubrication and orgasm, or does it have other benefits as well?
Yeah, so I would say that one of the best benefits, especially with women who have had vaginal deliveries, is for stress and urge urinary incontinence. That is one of the best indications to do an O shot. So let's just say you feel like you need to urinate and you leak. So by injecting PRP between the bladder and the urethra, it strengthens the muscle and the tissue, allowing you to not leak when you have the urge to urinate. Or if you chuckle or laugh or sneeze and you leak a little bit, that's about an 80 to 85% success rate with one shot. So that's a really nice type of patient where it's not just sexual function that we're treating. But yes,
Quality of life.
yeah, not
For
having to
all the
wear
moms
pads,
out there.
not having to wear pads, and not feeling like you can't go out of the house for extended periods without having to plan ahead.
Okay, so you mentioned that that's with one shot. Talk about the need, all of the other treatments we've talked about previously this month have been a series of multiple treatments. Is it different with the P shot and O shot? Do you need a series or do you need just one?
Well, it depends. So if in about 60% of patients with mild erectile dysfunction, we typically see a very good improvement to get them to a satisfactory level of performance for both men and women. Now, older women or those who may be more, depending on the issue, if we're talking about difficulty with pain, with penetration, where there might be some scar tissue, we might have to do a second treatment. Or on older females, it might take a second treatment. Typically, we'll start with one, and in about 60% of our patients that are not like having severe disease, whether it be male erectile dysfunction or female atrophy or loss of tissue, about 60% of patients will get very good improvement to the point of satisfaction with one shot. And if it doesn't get them to where we need to be, we would repeat it at around 2 to 3 months to see, and then you usually will get about 80 to 85% improvement overall for the types of conditions that we're treating. Stress urinary and urge urinary incontinence get better success rates with one shot, typically about 80 to 85% success with one shot. So we reevaluate at around 2 to 3 months, and if needed, we re-inject. And if it works, which typically you get a higher success rate with the second injection if needed, then you typically get results that last for about 1 to 2 years. And then you have to re-inject because the ongoing issues, whether it be age, genetics, ongoing lifestyle, those are always in the background causing the deterioration of tissue that's causing the underlying problem. And some patients that I won't treat would be smokers, not because there's an issue where I say I just don't treat smokers. The blood flow is diminished from smoking, that the likelihood of benefit with an O shot or a P shot, particularly a P shot, is significantly decreased, if not ineffective, especially in men with active smoking because of the underlying problems that smoking causes with blood vessel constriction, and it doesn't allow the PRP to work very well.
Wow. So what is the post care? What can a patient expect after getting one of these treatments? Is it life as normal, or is there anything that they need to be doing immediately post?
For the females, nothing. Normal activity. You might have a little bit of spotting for a day or two, nothing significant. So it's not like a full period, but you're not restricted. So you can go back to normal activities. In fact, if someone says, can I go back to the office? Can I resume sexual activity? Yes, there's no restriction for females. For men, it's a little bit different. There are no restrictions regarding any sort of sexual activity or normal gym or anything like that. But for men, we encourage a 6-week period of using a vacuum pump to encourage more blood vessel engorgement. That it is also part of the P shot treatment for 6 weeks. So you use a pump that we provide with the treatment twice a day for 6 weeks. But there's no post care and there are no restrictions for either procedure.
Very good. Well, I hope that this information helps you to learn more about the possibilities that are available with PRP. If you are interested in learning more about this treatment and having a customized consultation with Dr. Petropoulos at Potomac Medical Aesthetics, we've got a link right below this video to help you connect with us and learn more about this incredible treatment.